If you are a college student, then this announcement is for you. You may notice yourself and others taking part in the following activities on campus.
The Lovebirds.
Friends sharing drinks or food.
And dorm life. Living in close quarters with sometimes complete strangers.
All of these actions may seem harmless, but if one of you has the disease meningitis, it can become fatal.
The worst part about meningitis is that many times symptoms don't show up for several days, or they may be mistaken for the flu.
Meningitis, also called meningococcal disease, is an infection caused by a specific type of bacteria, Neisseria meningitidis. These bacteria can mimic human cells in order to evade the body's innate immune system. When they get into the brain and spinal cord, they cause inflammation or irritation of the protective membranes of these areas, called the meninges.
About 20% of all meningococcal disease cases occur in teens and young adults aged 14 to 24, and death rates are up to 5 times higher among people in this age group.
Along with flu-like symptoms, meningitis will often have other symptoms, such as nausea, vomiting, increased sensitivity to light, and altered mental status or confusion. For this reason, anyone who thinks they or someone else may have meningitis should see a doctor as soon as possible.
If meningitis is suspected, samples of blood or cerebrospinal fluid are collected and sent to the laboratory for testing. It is important to know the specific cause of meningitis, because that helps doctors understand how to treat the disease and possibly how bad it will get. If bacteria are present, they can often be cultured. Growing the bacteria in the laboratory is important for confirming the presence of bacteria, identifying the specific type of bacteria that is causing the infection, and deciding which antibiotic will work best. It is important that treatment be started as soon as possible.
Antibiotics can help prevent severe illness and reduce the spread of infection from person to person, and should also lessen the risk of dying from meningitis to below 15%. While most people with meningitis recover, approximately 1 in 5 live with permanent disabilities, such as brain damage, hearing loss, loss of kidney function, or even limb amputations. When someone is diagnosed with meningococcal disease, close contacts of that person are given antibiotics as a preventative measure.
Health officials recommend routine vaccination of adolescents and young adults because they have a higher risk for this infection than others. But the fact of the matter is, 3 in 10 U.S. teens have not received their first dose of recommended meningococcal vaccination and remain vulnerable. This is the most effective way to protect yourself against certain types of bacterial meningitis. Ask your student health service, your doctor, or call your local health department's immunization program or the CDC at 1-800-232-4636 to learn more about the meningitis vaccine.
Approximately 800 to 1,200 people contract meningococcal disease in the U.S. each year. Of those who get meningococcal disease, 10 to 15% die. Now that you know the facts, get the vaccine for meningitis. Tell your friends too, because the knowledge will unite us.